that they are fighting for us, but to say, please do not allow cuts to Social Security, Medicare, Medicaid, or other social programs. We did not cause the deficit with Social Security and Medicare. No, we paid for those benefits. They are not entitlements, we paid for them. And what did cause the deficit was two unfunded wars and a bunch of tax cuts that were also unfounded, and the crash that came about because of the casino that the Wall Street ran. What we cuts to the military budget, Pentagon, yes. To Social Security and the safety net, no, because those cuts to internally weaken us internally from the millions of people that don't have health care, jobs, homes, incomes. That weakens us. I have an example of an older person like myself, a longtime friend who is 72 like me. She was born in 1940. Her father died 2 years later, and fortunately there was Social Security widow and survivor pension, so she and her mother were able to live. In 1945, Judy was stricken with polio and had more than 10 operations on her hip under charity care and perhaps government subsidies. There was no insurance. Despite her continuing disability, she made it through school, got jobs, and worked for a time in a civil rights agency, and then in the public defender's office, and was married. In her late 50s, her husband was diagnosed with cancer because they were unable to afford adequate home health care. In the final stages of his disease, Judy quit her job to take care of him at home rather than let him be dumped in a nursing home. Her husband died when Judy was about 62, and then she tried to get a job again, and guess what? No job. No job, even now, 11 years later, because, well, she had to get a job because Social Security is not enough. It needs to be increased and strengthened. Her home has been threatened with foreclosure. Between the sagging economy and her age, there is no living wage job for her to get. And yes, there is wage discrimination in employment out there, you bet. Judy would work until she was 99 and drop dead at her desk, but employers don't want old folks. Social Security needs to be strengthened, not cut. Pushing old folks out of their homes for lack of money and into the street is a death sentence in the unforgiving streets for the homeless. Thank you.
My name is Judith Shattuck, and I want to thank the representatives who are here this evening to hear our stories. Thank you very much for being here. I'm affiliated with the Unitarian Universalist Network for Social Justice, and also a member of the Washington State Progressive Caucus. I volunteered to say a few things to you this evening about my own particular story. When my Social Security check comes in the mail on the third Wednesday of the month, I give it less $18 to my landlord. My Medicare costs me now $50 a month. Last year, it cost me $25 a month. So when people in Washington, D.C. start talking about cutting Medicare and Social Security, I get a little nervous. Matter of fact, I get so nervous that some nights I really don't sleep very well. When a number of years ago, my husband walked out the door, I don't need to go into the reasons about that. I was happy that he went. But that left me with 3 kids in grade school. And I struggled and struggled to put food on the table and keep things moving. I had 3 bright kids, and they worked hard and studied hard. And when they graduated from high school, before they graduated, they applied at very incredibly wonderful universities and were accepted. The only reason they got to go was because of Pell Grants and other loans, government loans and loans from the universities where they went. They made it through those 4 years with flying colors. 2 of them went on to grad school, and they are now serving the community in a very special way. One is the manager of a physical therapy what do I want to put? Yeah, I'm getting old. I lose my words. Physical therapy, and she has achieved the status of 2 specialties that there are only like half a dozen people in our state that have those 2 specialties. The other is practicing in social services as a therapist with families who have experienced difficulty and have a great deal of anger that they're exhibiting. So these kids of mine, even though we had hard times, were able to rise above that and come home and serve their community. They would not have been able to do that. They probably would have minimum wage jobs or no job at all at this point.
My name's Carl Wyrock. I'm a family doctor at a community health center in Seattle, and I'm here to talk about health care. And first of all, we need universal access to health care for all Americans. We've heard that people say you need jobs. Well, you need jobs, but let me tell you about Molly. Molly works in an elderly care facility. She likes to take care of old people, but she has a lot of medical conditions. And just by working in this job, she does not have health care insurance, because that's what happens in a lot of jobs in America. You don't get health care insurance. Well, so when she works in her job, her diabetes gets worse and worse and worse, and she no longer can come to work anymore, and then she loses her job, and she gets on Medicaid. And guess what? She has health care for the first time. Her diabetes gets better, she feels good, and guess what? She goes back to work because she likes her job so much. She works hard, but she can't afford her medicine because she no longer has health care insurance. Her diabetes gets worse, and guess what happens? She loses her job again, and she gets on Medicaid, and then she gets health care again. And she gets better because she can take her medicine. You see a cycle here? Jobs don't guarantee health care. Even if you have a job, you may not be able to afford your health care, your insurance, your medicine, and you can get worse. So for poor Molly, we had to tell her not to work so that she could get health care insurance. And that was the only way she could take care of her diabetes. And speaking of diabetes, let me tell you about Tom. Tom drives a bus in South Seattle for a small company. He works 5 days a week, but his company doesn't have health care insurance. Tom has diabetes. So guess how he balances the budget? He uses his insulin 5 days a week, and when he's off, he just takes a holiday from his insulin. Well, that's how he makes ends meet. The bottom line, folks, is jobs don't guarantee health care. We need a safety net. We see these people all the time. And if we don't have a way of providing health care for our citizens who need it, then we don't deserve to be respected as the world's greatest power. Thank you very much.
My name is Mike Yarrow, and until I was 70, I was the health insurance private company's wet dream. I was never in a hospital for myself. When I turned 70, they discovered 2 cancers. Since then, I've had 6 operations, and I have another one coming up for the 3rd cancer. And luckily, I get a pretty darn good socialized medicine, which is Medicare. I think and it should be for everybody. Why do I, as I get to be an old fart, get it and nobody else gets it? You know, that's not fair. But I think I never saw all the bills. I think maybe total costs for my care in the last couple of years has been up towards $1 million. I saved all my life so that I could have something to retire on, and that would be gone by now if I'd had to pay for all that stuff. So Medicare, I don't know whether it works for everybody. It's worked so well for me, and why not have Medicare for all?